So I'll talk about some of the myths that I encounter with my patients that spend some time educating them around the areas of hip and knee replacement. One of the common myths is that patients who have certain surgical approaches recover more quickly or than other approaches. And I think the research has shown over the last 5 to 10 years that actually certain approaches are not what allows patients to recover, but it's more likely patient specific. If you're a young, healthy, active patient, you're going to recover more quickly than those who are not so. So I think one of the issues I tell patients is to focus on a good relationship with your surgeon, understanding that they've done a lot of the procedure and that they do it well. I think that's the single most important thing for enhancing your recovery, as opposed to going to someone specifically just for a surgical approach or a novel way to do something that's not been proven in the scientific literature to be more beneficial. So I think I spend a fair amount of time educating patients on that. I think it's important to get that word out. One of the newer things we're addressing that's now and the FDA is involved is an issue of metal bearings. And I have a lot of patients coming in talking about metal bearings and issues related to that, and we're certainly discovering now in the last couple of years that metal bearings, while having the advantage of having better long-term wear properties and maybe lasting longer in certain patients, also have some issues with metal ion sensitivity in patients. Much like women who are allergic to metals who can't wear certain earrings, we now know that patients have reactions to metals, and those particular implants have higher metal ions than others. And so in a small subset of patients, we're finding some very big issues around metal bearings. So that's something we're taking a look at. We're studying, continue studying it pretty intensely. But for now, I shy away from those metal bearings in my practice, just because there's some additional risk we don't fully understand at this point.